Okay. Hello, colleagues. Hello, everybody. One of our colleagues just telling me right now that tomorrow morning during his breakfast, he will miss this. Yalla bina, it's enough. Let us go. It's almost there. Say it again. The headmaster, okay, yeah. Day before yesterday during my breakfast, by the way, and I met one of our colleagues and I started to talk with him. And by the end of the things, I just wanted to give him my business card. And then he said, no, don't need. Oh, I already know you very well. You are Dr. Hassan Mataraya. Yes. أخو عوض صلاح على طول, his brother. Anyway, where are we? Yes, okay. We are going to start the session for okay, we are going to start kind of an introduction, couple of slides about the regional professional diploma, and you are lucky today that we have three keynote speakers, and then we'll follow with the recognitions for the pioneer in the career of the primary health care and the family practice. As a background about the regional professional diploma in family medicine, in the 2016, member states endorsed the EMRO resolution for scaling up of the family practice for progressing toward universal health coverage, in which actually the family practice became kind of an overarching strategy to improve the quality of the service delivery at the level of the primary health care facilities. In the year of the 2018, and in full joint collaboration with our colleague from WONCA, we published the first book actually about the family practice and the primary health care in the region. And this was during Astana conference. In the year of the 2020, family practice became part of the joint work plan for the primary health care partners, UNICEF, UNFPA, UNAIDS, UNHCR, WONCA, and our colleagues from the Arab Board of Health Specialization. In May last year, WHO and the Arab Board of Health Specialization, they signed the collaborative agreement in which the topic for the family practice and the regional professional diploma was part of the collaborative agreement. This followed with the formulation of the regional professional diploma steering committee, which became kind of governance body to take further step to implement the diploma from the regional level to the national level. Early this year, WHO, Arab Board of Health Specialization, and a number of our ministers of health officially launched the diploma. First cohort started in October, a couple of months ago, for the diploma. And second one, we discussed it in detail yesterday with our colleagues from the Arab Board, is going to start in April, inshallah. Colleagues, today, it's a historical day, to tell you the truth. 14 member states from our region, majority actually, 2/3 of our countries, is going to sign the call of action. We call it Cairo Call of Action for Regional Professional Diploma in Family Medicine. In addition to our colleagues for primary health care partners, including UNICEF, UNFPA, UNAIDS, UNHCR, WONCA, and in addition, of course, our colleagues from the Arab Board of Health Specialization under the umbrella of the Regional Health Alliance. As I mentioned at the beginning, that we have three keynote speakers, Dr. Ahmed El-Mandari, the first keynote speaker. Dr. Ahmed, are you with us, sir?
حياك الله دكتور حسن. I am with you, but I'm trying to adjust my camera. Sorry for not.
Okay, take your time, sir.
Yeah. Yes, yes, Dr. Hassan. Thank you very much.
Yes, over to you, sir.
Thank you, Dr. Hassan, and thank you, colleagues, for your participation into whatever discussions we have had for the whole week but definitely for the last 2 days, on this important major milestone, if I may call it, in EMRO, and it is member states when it comes into promoting family medicine and strengthening our primary healthcare systems, which ultimately have an impact on whatever goals that we have been making for the last definitely 3 years, but even before, calling for building resilient health systems, making sure that our communities and societies are actively engaged in their health. Our decision makers and planners are fully aware and committed and well oriented about the needs of the health system and the importance of primary health care. That is, well expressed in many of the meetings since the Alma Ata Declaration in 1978 as a road or as a tool to reach health for all. And now with COVID-19, it has been more visible, to everyone, including the normal public, people in the society, that the best option, the cost-effective option for them is having healthcare facilities, primary healthcare centers, with services that are run by well-trained, skillful staff, including, other members of the team, but definitely physicians who are running these services, well-trained, well-oriented, skillful, and, making sure that they will receive very accessible, high-quality services. And we have been talking about it several years in the past, and in the region here, there are several resolutions on that. And I found it really a very good opportunity that we are all coming together under one spirit of creating resilient health system, strengthening our health systems, by focusing on primary health care and introducing this sort of diploma, which will help us in filling whatever gaps when it comes into the workforce of family physicians in the region. So I'm really happy to see that the signatories are coming together with member states and support whatever strategic plans that we have made. We need to fight, for this sort of right in a very strong, professional, scientific, evidence-based manner. In order, as we said yesterday, colleagues, and discussed that, unfortunately, there is some resistance from maybe some societies, professional societies, resistance from some member states and some authorities in these member states, not because they, for the sake of resistance, but because they have sometimes misunderstandings or misperceptions about the diploma itself. And as I mentioned yesterday, many of them are doubting maybe the quality of this diploma. Now I have no doubt that us coming together and reviewing whatever, details of the program supported by the Arab Board for Health Specializations, it is going to be a really strong program. And the outcome of this program after a few years from now, to the upcoming future, we will see the fruit of having such a program supporting our countries, particularly those countries which are suffering from, difficulties, shortages, and lacks of resources, lacks of systems in their countries. We will see the fruit of that in these communities and societies. So thank you very much, Dr. Hassan, Dr. Awad, and all colleagues who supported building this program from all agencies and from the Arab Board of Health Specializations. And we assure you that we are very much committed in WHO in fulfilling the expectations of our communities and having collective efforts in promoting health systems, primary healthcare, family medicine, and thus making it really resilient, leaving no one behind in each individual member states here in the region, and definitely beyond. So Jazakallah khair, Dr. Hassan, that's all from my side. And in fact, before I conclude, I'd like just to express also sincere thanks to our experts who have come from different parts of the world, and from different institutions and academia from within and outside the region. We really appreciate it. We are together. And just a request from you, Hassan, to keep all those who participated in this meeting and at this session, keep them updated with regular emails, with regular messages from you to, for them to feel that, yes, our time we have spent in Cairo at this moment is not wasted. It resulted into very concrete steps that will definitely help strengthening our systems and our health systems in the region. So, Jazakallah khair, Dr. Hassan, back to you. Thank you very much.
Dr. Ahmed. Thank you very much, really. Really appreciate it. I mean, your keynote speech actually reflected our meeting yesterday with your good self and our colleagues from the Arab Board of Health Specialization, His Excellency Dr. Omar Rawas. And it was very, very good discussion for full day, in which we actually agreed on kind of a roadmap for the coming period until February, inshallah, and then we will continue during April for the second cohort and build on it. The second keynote speaker for us is Ms. Hind Sabri. Ms. Hind Sabri, of course, it is a well-known actor, and actually she is a World Food Program Goodwill Ambassador. We have a video for her. Please. Thank you, sir. ربنا يكرمك يا كريم.
Dr. Ahmed Al-Mandari, Regional Director, World Health Organization, Regional Office for the Eastern Mediterranean. Distinguished participants, ladies and gentlemen, thank you for giving me the opportunity to participate at this high-level meeting, addressing a very important topic that touches our daily lives and is closely linked to other sustainable development goals that I continue to support as a passionate advocate. Being a mother from the region with a family of my own, I am totally familiar with the important role the family physicians are playing in improving community health. Their role goes beyond the clinic to being fully engaged community partners, to being part of the family. I seek my family doctor's advice and support, not only when someone is sick. I also reach out to them for advice to maintain health, prevent disease, or just for checking medical information or second medical opinion. This strong physician-patient relationship requires dedicated practitioners who are well-trained, not only in medicine, but exceed that to develop skills such as communication and coordination, essential to fulfill their role, delivering sound primary health care, advice, and treatment, referring cases to other health professionals and medical specialists, in addition to proactively supporting their communities with preventive healthcare measures. It's impossible to mention family doctors without references to high-quality primary healthcare. Family medicine is part of this bigger health system that is necessary to achieve population health and well-being, better patient experience, and lowering per capita costs of quality healthcare. The benefits of primary healthcare do not just impact the individual patient. Primary care also translates into healthier communities, as proven by research. An increase of one family physician per 10,000 people is associated with an average mortality reduction of 5.3%, or 49 fewer deaths per 100,000 people per year. Our region has shortage and uneven distribution of family physicians, which negatively impacts population's health. Today, a call for action document is being declared to increase the number of qualified family physicians in the region through a regional professional diploma program. I stand before you today to support this cause fully. I believe that this family medicine program is an important regional initiative to help ensure high quality, efficient medical care. By bridging the gap of family physicians shortage and attracting physicians to serve in communities that need them. This program will also help improve the way care is delivered and help meet our regional healthcare goals, paving the way for universal health coverage through World Health Organization's regional vision of health for all, by all. Thank you again for the opportunity to join you all today. Hind Sabri.
I actually would like to thank Dr. Belgasem Sabri. Dr. Belgasem Sabri is uncle for Ms. Hind Sabri for his support and really get great support. Thank you, Dr. Belgasem Sabri. Thank you very much. The third keynote speaker is Dr. Anna Estevidal. Dr. Anna, she is a world president for WONCA. Dr. Anna, the floor is yours. Come, please.
Good afternoon. What more can I add after this testimony? Dear Regional Director, Dr. Ahmed Al-Mandari, dear Hassan Saleh and team, dear colleagues of all professions, dear friends, thank you for the invitation to speak at this important event. I'm greeting you on behalf of WONCA, the World Organization of Family Doctors, the global network of more than 500,000 family doctors engaged in research, education, and professional development. WONCA has member organizations in all WHO regions and in 110 countries, 15 of them in the East Mediterranean region. The photo you see here is from my practice in Oslo, Norway, where I have worked as a family doctor, university teacher, and trainer for more than 30 years. We are here to celebrate and reconfirm our commitment to strengthen primary health care because we know it is a prerequisite to reach universal health coverage. We have the evidence. 80% of a person's health needs through the life course can be covered by primary health care. Primary health care is teamwork. I will explain why family doctors are key to maximize the potential of the primary care team. It is intuitively easy to understand what heart surgeons, neurologists, and gynecologists do. Their approach is defined by the organ system of their specialty. Family medicine is in its nature fundamentally different from other medical specialties. It is not disease-oriented, it is person-centered. It has its own curriculum and research base, and it is based on a set of values. Family doctors work in different political systems and different health systems, and our practices can look different depending on the local context. Here you see pictures from Guatemala, Nigeria, Indonesia, and Norway. Despite the differences in context, we have the core values in common. We deliver personal, continuous, and comprehensive care. Values might sound pretentious, kind of soft. Let me give you some hard evidence. This Norwegian registry-based observational study of more than 4 million patients and their GPs went viral when it was published in British Journal of General Practice in November last year. The conclusion is this: the length of a regular GP-patient relationship is significantly associated with lower use of out-of-hours services, fewer acute hospital admissions, and lower mortality. The presence of a dose-response relationship between continuity and these outcomes indicates that the associations are causal. when the relationship lasted for more than 15 years. These occurrences were reduced with up till 30%. This is an excellent example of how continuous personal patient-doctor relationships impact health outcomes. And let me elaborate a little bit. We call them values, you can call them principles. Let us take the first one, the personal part. One of our most significant forefathers in family medicine, the late Canadian professor Ian McWhinney, put it this way. Family medicine is the only specialty which defines itself in terms of relationships, especially the patient-doctor relationship. We understand the personal relationship is the basis of trust. Trust makes you share information which you wouldn't volunteer to a stranger. Information which can be crucial for diagnosing and tailoring treatment of disease. Medical conditions do affect each person differently. These differences reflect who we are as individuals, physically and emotionally. We are the result of millions of years of genes and biology, decades of psychological experience, a product of the culture we grew up with and the times we live in. And all of this come to the forefront when we are sick. You are also more likely to follow someone's advice if you trust them. We have seen that clearly during the pandemic. That is why the family doctor is centrally positioned to provide disease prevention. In family medicine, prevention and treatment go hand in hand, which is part of the comprehensiveness of our work. That means to take all health issues into account, regardless of organ systems, age, or gender. People often don't have one reason to see the doctor. They have several, at least over time. The family doctor is trained to consider all aspects of the complexity of the individual patient and diagnose and treat accordingly. To put it in perspective, the opposite of comprehensive is fragmented. In our times, fragmentation is a general trend in society and in medicine in particular. This is Arturo Casadevel, professor of microbiology and immunology and infectious diseases. He thinks fragmentation is harmful. He believes that by making doctors more specialized, everyone is digging deeper into their own specialism and really standing up to look over into the next trench. The solution to the problem might be right next door, but they're at risk of losing it because they are so focused on their own field. Last but not least, already addressed the start, the jewel in the crown, continuity. This is maybe the most important explanation of the impact of high-quality family medicine on health outcomes. The conclusion of the research of the late Barbara Starfield is well known to you and has been reconfirmed time and again. Continuity of a personal relationship with a freely chosen primary care doctor over time accounts for better health outcomes, and much lower costs. After almost 35 years in clinical practice, I can testify on the power of continuity of care. And as we see, new evidence supporting this experience keep coming in as we speak. Universal health coverage is inevitably related to social security, which has been a topic also for this meeting. Health and social care address two aspects of the same needs, yet they have developed into separate and independent services in many systems, as the pandemic exposed so clearly. This is another example of how fragmentation drives care systems in the wrong direction. I'm sure you can make sense of these three examples. taken from my practice and my experience over the last years. It's not enough to keep patching up the wounds of a battered woman and then sending her home with no referral to safe shelter. It's not enough to offer an unemployed person with diabetes the very best dietary advice and regular monitoring of his blood glucose levels if we don't address that he has no money to buy food. The health of women and newborns is always in jeopardy during a crisis. Women often prioritize others' needs before their own. Like again in the pandemic, when social services for the sick and elderly shut down, many mothers of infants stepped in to fill the gap, posing health risks to mother and child. Family doctors positioned in the community can help bridging that gap between health and social care. For primary care to be effective and efficient, it needs to address local needs. Societal change is always reflected in healthcare and first and foremost in primary care. Family doctors have ears to the ground and are therefore also the first one to observe the impact of societal change, as well as the impact of health policies. This knowledge is useful to all policymakers and politicians. Not asking for it is a missed opportunity. Research takes time. Reports from the field can be delivered here and now. In a TEDx talk a few years ago, I made an attempt to explain to the general public why they need family doctors. The title of the talk is Why Hyper-Specialized Healthcare Needs Super Generalists. You'll find it on YouTube. Okay, so much for the beauty of family medicine, the specialty of family medicine. But as we all know, it's not sufficient to put physicians in a primary care setting and call them family doctors. They need training in accordance with the core values and our knowledge base. The Lancet Commission of 2010, the health workforce for the 21st century, concluded, in order to meet the population's health needs in the time to come, 50% of the health workforce should be trained for primary care. This is a call to us all for capacity building, and we share the responsibility for that to happen. WHO EMRO has been working closely with primary care professionals in general and with family doctors in particular over many years to rise to this challenge. And as we know, wait a minute, I'll go back and then I will give me a minute because I was a little bit, I'll jump before I go to the diploma. On training on family medicine, someone said what you see on the screen. Family medicine is the easiest specialty to do badly and the hardest to do well. To do it well, the doctor needs a broad repertoire of skills in addition to master the basic medical knowledge. To do it well, we must be trained in handling medical complexity, living with clinical uncertainty, and also be able to integrate fragmented medical knowledge and make it meaningful to the patient. With these skills, family doctors tailor care and contain people in primary care, which is different from detaining patients in primary care, which sometimes seems to be the perception. The goal is to avoid unnecessary referrals to secondary care and unnecessary admissions to hospitals. My hope is that the family medicine diploma program will provide primary care doctors with these skills in the region. This diploma, the program and this diploma is a huge achievement in so many ways. It raises the profile of the specialty of family medicine in the East Mediterranean region. It bridges the existing gaps in training of primary care physicians in the EMRO countries. And let me add, it is an excellent example of good collaboration between WHO and WONCA on the regional level. And no surprise, EMRO leads the way. So, on behalf of the global community of family doctors, I extend my heartiest congratulations. The family medicine diploma is a step on the way to make WONCA's vision come true. Now, more than ever, what the world needs is high-quality primary care. A close-to-home healthcare hub that functions in seamless collaboration with social care and public health services, as well as with hospitals. That requires a strong interprofessional team with a qualified family doctor on board. My goal here today has been to clarify why family medicine is important to reach universal health coverage. I will end with a quote from this paper published in British Medical Journal in April 2019. It compared a number of high-quality scientific articles on what we call continuity of care. Close to 82% confirmed that the quality of ongoing doctor-patient relationships affects mortality rates. There we go again. The better the individual's relationship with their long-term doctor, the lower their mortality rate from all causes of death. The researchers, led by Sir Pereira Gray, conclude, for 200 years, medical advances have been mainly technical and impersonal, which has reduced attention to the human side of medicine. This systematic review reveals that despite numerous technical advances, continuity of care is an important feature of medical practice and potentially a matter of life and death. From what I've heard here, not least the last session with the young, our coming young colleagues, I feel that I can say that the future is bright. Thank you for your attention.
Colleagues, we cannot actually celebrate the signing of the call of action for the regional professional diploma without recognition for a number of physicians who actually contributed a lot in their professional career for the primary health care and for the family practice. The coming session, we are going to recognize number of physicians from 5 countries in our region for their effort and the contribution to the primary health care and family practice. Over to you, Dr. Said.
So, hello, everybody. And as Dr. Ahmed Al-Manzari mentioned in his opening remarks, he highlighted the role of our colleagues who paved the way for strong primary health care and family medicine in the region. For this, Family Medicine and Primary Health Care Award was suggested by our regional office to recognize primary health care professionals who are either physicians or nurses who has exceptional contribution to the primary health care and family medicine and demonstrated leadership, commitment, and dedication to the cause advocating for primary health care and family medicine, especially in emergency situations and resource-sparse countries. Nominations from member states were received by the regional office and reviewed, and the following 5 pioneers for family medicine and primary care were nominated for this award. Our first doctor is actually joining us online, and he's Dr. Kashif Jan. He's from Pakistan. He trained several health facilities, professionals, and community members on family practice approach and community engagement. Throughout his work as a medical officer and with support of the BHC Management Committee Fund, the labor room as functioning in several basic health units, supervised registration of hundreds of families and family folders with their regular follow-up visits. Dr. Jan, you are joining us online, and this is your award.
Yes, Dr. Jan, this is Dr. Rana Haji. I'm the Director of Program Management, and I'm honored to give you all this award. I will give it to you online, right? We have to learn how to do this virtually now.
Thank you. Thank you. Thank you. Thank you. Thank you. Thank you.
And our second pioneer is our dear professor, Muhammad Rasul Tarawna from Jordan. Dr. Rasul Tarawna is the president of the Jordan Society of Family Medicine. And he worked over the last years on establishment of family medicine practice approach in Jordan. During his work in the Ministry of Health, Dr. Tarawna had led a number of major initiatives to establish the professional career of family physicians in Jordan. Can stay here for any other questions. Okay. Yes. And our third, yes. Our third pioneer is Mr. Saeed Wahdani from Morocco. He's actually a nurse, and for the past 12 years, he managed and supervised important primary healthcare initiatives, including chronic disease care and surveillance and rural health program, in addition to being a focal point for a control program against viral hepatitis. He contributed to the establishment of the minimum service package of the first level primary care establishment and family medicine in 10 health centers and a respirology center, the Respirology Diagnostic Center in Morocco. Before that, he was responsible for the National Well Children and Immunization Program as head nurse in 2 primary healthcare centers. Mr. Saeed, are you with us? Disconnected? Connected? So I think he can see us. Can you bring him on the screen? He actually raised his hand. Ask him to open the camera. Can you open the camera, Mr. Saeed? من فضلك ممكن تفتح الكاميرا يا أستاذ سعيد؟ بيفهم عربي، أنا كلمته بالتليفون. Yes. So it's okay. Yes, thank you. So our third pioneer is Dr. Nizar Taib from Iraq. And during his term as the Director General of Health in the Hawk Governorate, Dr. Nizar adopted a strategy to improve the quality and accessibility to minimum standard health services through strengthening primary healthcare services and encouraging family doctor system. In collaboration with several UN agencies and international organizations, he established a number of centers of excellence in Kurdistan region in Iraq. Dr. Nizar. Our last pioneer is Dr. Samar Musmar from Palestine. And Professor Musmar is the first board-certified family physician in Palestine. She launched important international developments in family medicine. And she managed important primary healthcare projects in collaboration with the Ministry of Health. And Dr. Samar, the award will be presented to you by our director, Dr. Awad Matareya.
شكرا يا عوض.
So now I'm requesting our physically present pioneers if they have 1 to 2 minutes reflection or feedback. We start by Dr. Muhammad Rasul Tarauna, if you have any feedback, sir.
Good evening. First of all, I would like to thank WHO for organizing this amazing gathering of experts. And I want to congratulate them on occasion of the Universal Health Coverage Day. I'm here lucky that I witnessed the born of the idea of a regional diploma 10 years ago in the ministerial meeting here at the region, and would like to congratulate Dr. Hassan Salah and his patients for following this file over this long time. And today we are celebrating the call of action, and I will consider 15th of December as the born of a sister or a brother of the family medicine board program. Really, we are in a deep shortages of family physician in the region. And this diploma, I think, will help in fitting this gap. I'm writing an article on a weekly basis in Al-Rai newspaper, and 2 days ago I wrote directing my speech to Prime Minister and ex-Prime Ministers and Ministers of Health, saying that the way to universal health coverage should be through primary health care, stringing primary health care with a core of family medicine or family practice approach within it. So this is the only short and easiest way to strengthen our health system. Unfortunately, we all know that our health system in the region, at least I'm sure that here in Jordan, is completely oriented toward curative care. So I think it's time for the call action to reorient our health system to be people-centered care that can provide the continuous comprehensive scope of care. Congratulations, WHO IMRO. Congratulations, Dr. Awad, Dr. Hassan, Dr. Rana, and Dr. Ahmed for the efforts, and hopefully that we can, in the coming years, see an enough number of family medicine. Thank you for this occasion, and thank you for awarding me this, and it will be in my memory. Thank you very much.
And so thank you. And now, if Dr. Nizar have a few comments or reflection.
Thank you very much, Professor. Good afternoon, ladies and gentlemen, distinguished guest, organizer. I am really honored today to be with you. As they present me as former Director General of Health in Duhok province in Kurdistan region of Iraq. I worked during very stressful period of time where there were many crises. There was a financial crisis, a war against ISIS, a humanitarian crisis of mass displacement from the rest places of Iraq to Kurdistan region, and particularly to the province of Duhok, where I was managing health. And there was also followed by an outbreak and pandemics. I did believe from the beginning that with the resources we have and all the challenges that we are facing, we have only one choice, is to strengthen the primary healthcare. Without strengthening primary healthcare, it was impossible to reach everyone. It was impossible to extend the health to all and every displaced and refugee in our country. I can only share one example with you. In 1 week, in our province, the population from 1.3 million increased to 2.1 million. Without a good cooperation and organization and primary health approach, we were not able to prevent the outbreaks and to extend the health to everyone. In 27 camps, half of the refugees and IDPs, and the rest were in the host community. So I hereby congratulate WHO EMRO for this initiative to highlight the importance of family medicine, family doctor, and to strengthen the primary healthcare in our region. I did believe in that also in the past, being as a child psychiatrist and a mental health expert, worked before for WHO, that integration of such programs in primary healthcare is a must. And we have to encourage and go ahead for that. Thank you very much indeed. Thank you. Thank you. Very much proud.
And now the chance for our online pioneers. If Dr. Samar Musmar would like to intervene, 1 minute reflection.
Thank you very much for allowing me to be in this meeting. I'm actually now in the United States of America, and I'm practicing primary care family medicine here. I have just want to let you know how my journey was with family medicine in Palestine. When I moved there was no idea about what family medicine is, and I started family medicine on my own, like my private practice. It was a struggle to get people to understand what family medicine is. The struggle I found was more with the physicians themselves. The people, you just explain to them the idea and they just love it so much. My struggle for the past 30 years is now fruitful. I am so happy that there is a program that produces family doctors in Palestine. I am very happy that I participated in so many regional efforts of WONCA and the Arab Board, and I met so many colleagues that they have the same passion that I have for family medicine. I can tell you that from my experience here in the United States, I did work in Saudi Arabia, and most of my work was in Palestine. The principles are the same. So family medicine is all about excellent, comprehensive primary care with excellent relationship and trust. And it works in any health system, whether it's like a very advanced health system where I am practicing now, or in primitive resources. It works much better in the primitive or very low resource countries. So thank you very much for the initiatives and keep the good work.
Thank you so much, Dr. Samar. And now we have intervention from our Director of Programs, Dr. Rana Al-Haji.
Thank you. Thank you very much. It's really just wanted to add my 2 words worth to this really important meeting. In addition to giving the awards, I'm sure many of you who used to follow the Wheel of Fortune, if you remember that American program, Dr. Samar, since you are there was Dana White, the lady who gives the awards on a regular basis. So in addition to playing the Dana White role, I would really like to comment and maybe few closing remarks at this meeting, which is really important. And I very much appreciate the presence of many colleagues. I know I was here at the opening and the closing, and then hoping in between that I have absorbed all what was discussed for these 4 days. I was following very closely with the colleagues, and I know this is a very important meeting for us, especially after COVID. So when we were initially discussing the whole concept of this meeting and the need to have it, I thought it was very important to do this after COVID, because COVID in particular highlighted the importance and continuity of health services, the importance of primary healthcare. I think we felt it more strongly than ever during COVID. However, and I really appreciate all the advocacy we are doing. I just came from an event at FIFA in Doha, and I cannot tell you how important it is to have strong advocates. You know, we were with David Beckham and Didier Drogba and others, and people listen to them. They listen to them more than they listen to us. And I very much appreciate Ms. Sabri's intervention, and Dr. Belgasim. Next time you have to bring her with you. We need a promise. I don't want her to be just virtual. I would really like her to be with us in person. But at the end, and of course, we are all advocates. Our role here, in addition to being technical experts, is to be advocates as well for primary healthcare. But more importantly, we need to translate our advocacy into policies and into implementation on the ground. So what we are doing now, we are getting ready to launch in a minute to sign the regional program. And I very much appreciate how much work went into this. I really appreciate the contribution of the Arab board. We have Dr. Omar here with us, Rawas. This was a very important collaboration, but this is one example of a concrete action that the regional office is taking to strengthen capacity on the ground for family medicine. This is not just, papers and documents, which are all important, but at the end, we need to show how this is really serving people in our region. And this is going to need very strong commitments at the end. You know, we can train people. It's a great program, and I have a lot. And, fortunately, our regional director is a family physician himself. I'm an internist, close enough by training. But I think, the training itself is not enough. We can train these people for 2 years to get the diploma, to be well qualified to practice. But at the end, they're going to need the full commitment of their governments. And for them to be able to stay and to be motivated, we need to train them on a regular basis. We need to make sure they have adequate incentives on the ground. Otherwise, we have to be realistic. These people will not stay. So the political commitment at the end, and we cannot just say, because we're talking about political commitment, it's only the role of governments. All of us in the room have a big role, because I know many of the senior experts, and really would like to acknowledge the senior experts, the ex-directors. I know you all are very connected in your respective countries, and I know you can influence policies, and you can make sure that primary healthcare is actually as attractive as cardiology or as surgery. Family medicine is seen, public health is seen, and I hope the COVID has taught us many important lessons about the importance of public health and primary healthcare. They share the first 2 letters, PH. So I really think the proof will be in the pudding. What I'm hoping, I was discussing with Awad and Hassan, both Matariyas, no, I'm just kidding. We're discussing, if we're going to have another meeting in 2 years, we need to show success stories on the ground. We need to show all what we are talking about today. Hopefully by then we can demonstrate the benefit of programs like the regional family medicine diploma, but we need to show practically what works in our region. We need better examples of what works in our region, and how can we keep strong practitioners motivated and able to deliver the people-centered care we have been all talking about. So I don't want to make it much longer with you, but I would like to thank you again for being with us. Many of you traveled from very long distance. I hope you found the interaction with colleagues, with meeting each other very productive, inspiring, and motivating. And I really hope, in addition to signing this commitment for the family medicine program, that you will sign with us a commitment to stay with us and to really help us in the next few years as we move ahead with full implementation of primary healthcare on the ground. This is really the commitment I would like to ask from all of you and from all of us here in the room and online, and hopefully as one team we can deliver. Yadullahi ma'a al-jama'a, as we say. Thank you all very much.
Thank you very much. Thanks a lot. Thank you very much. Colleagues, many of you actually, they asked me before we are going to sign this call of action for the regional professional diploma, what exactly is this regional professional diploma? Yes, of course, it make a lot of sense. So let us just have just a couple of minutes outlines for the regional professional diploma. Dr. Mona Osman, professor in AUB, American University in Beirut, is going to give us a brief about it. Over to you.
Okay. Hi, good afternoon, everyone. So I have 3 minutes to convey the message. So what is the Regional Professional Diploma in Family Medicine? So this diploma is a 2-year structured program that will be offered in a blended format. And a blended means that it will be online and it will be face-to-face at the same time. It's a collaboration between, as you already heard, between WHO, between the Arab Board of Health Specialization, WUNCA, and at the same time, UNICEF, UNFPA, UNHCR, and UNAIDS. What's the aim of this diploma? It's really to equip its graduates with the knowledge, with the skills, with the attitudes that are needed to provide efficient primary care, if I can say, and at the same time, to improve the quality of care at the primary healthcare level. So, who are our targets? Our targets are the general physicians who do not have any vocational training after finishing the medical school, but they should have at least 5 years of experience after medical school, and they should have 3 years out of these 5 years experience in primary healthcare. Of course, they should be practicing, and they should have still a current clinical practice, and at the same time, a valid license to practice. And what does this diploma offer them in addition to the diploma? It will offer them a future career in family medicine if they want. So after completing additional 2 years, yani after earning the diploma, if they want to go more into family medicine, they can complete 2 years of supervised clinical work under the supervision of the Arab Board of Health Specialization, and they can apply then to the exams of the Arab Board, and if they pass these exams, then they will be given the title of specialist in family medicine, okay? So what are the basic blocks of this diploma? There is a structured curriculum based on defined competencies that are defined by WUNCA, defined by the ACGME, and defined by the American College of American College of Canadian Physicians for a family physician, okay, for a general practitioner, a family physician, and this curriculum will be updated regularly. So we have an online component which will be delivered through Moodle as a learning management system. We have a face-to-face on-the-job training, so it's not all online, but this will be delivered in specialized training centers. We have online tutors and mentors. The trainees will be distributed, 20 trainees for 1 online tutor. They will be following them on a regular basis over the 2 years, and they will be having online discussions with them, similar to the face-to-face discussions. And at the same time, we will have clinical trainers also for the 2nd year. It will be 5 trainees for 1 trainer. And all through the 2 years, we will have formative and summative assessments. So it's not just reading the material, going through it, and just doing clinical examination. They will be assessed all through with multiple formative assessments and summative assessments. So this is just the snapshot of the program. So this is the 1st year. As you can see, it will be the 1st year fully online, delivered through Moodle. It will include 4 terms, and each term is composed of 2 blocks. So we have a total of 8 blocks. Each block is 6 weeks duration. The block includes, of course, 4 weeks of self-study by the trainee. Then, of course, under the supervision also of the online tutors, they will have 3 online sessions where they will have discussion of clinical cases, case scenarios, and going over the material that they learn. They will have also a 1 masterclass online webinar, discussion forums, which are the, if I can say, the counterpart to 1 minute. Yeah. the counterpart
Please.
of the virtual ما استقوا علي أنا 5 أيام يا زلمة. Anyway, طيب, we'll have discussion forums, formative assessment. They will have a portfolio and logbook and a final written examination. The second year, it is face-to-face and online, and they will have at the end a final year written and OSCE examination, okay? So these are the modules. We have 8 modules, but this is the last slide. This is the last one. What is special? They would know what's special about regional family. So it is accredited by the Arab Board of Health Specialization. It offers the path, as I said, to earn a specialty in family medicine. The trainees have the opportunity to study while working, so they don't have to leave their work. There is an affordable tuition fees. It will be delivered by qualified tutors from the region, and it is a forum to share clinical experience among trainees from the region in a way, and maybe globally later on. And thank you.
Thank you very much. Thanks a lot, Dr. Mona. I really appreciate it. Thank you. Thank you very much. Colleagues, will have a short infographic to present the outlines for the regional professional diploma. Karim, ready? تمام. اديني الانفوجرافيك.
There is a severe shortage of family doctors in the Eastern Mediterranean region. Only 700 family practitioners graduate each year, but an estimated 21,000 per year are needed to reach the regional target of 3 family physicians for every 10,000 people by 2030. To help solve this challenge, in March 2022, World Health Organization joined forces with the Arab Board of Health Specializations, ABHS, and several other key partners to launch a 2-year regional professional diploma in family medicine. Family medicine is defined as the medical specialty which provides continuing and comprehensive health care for the individual and family. It is essential for primary care and to achieve universal health coverage. Today, and as part of the Universal Health Coverage Day celebrations, we are proud that countries of the region and their partners are gearing up to support implementation of this diploma by adapting it to their country's education system and standards, initiating joint initiatives and plans for implementation, ensuring that diploma graduates have opportunities in their national health systems, and establishing mechanisms for periodic monitoring and evaluation to review and accelerate implementation. By supporting the diploma, countries are taking an important step to build capacity in family medicine. Ultimately, that will enhance health system resilience throughout the region.
Very much. Colleagues, as I mentioned earlier, we have 14 member states. We are really lucky to have 14 member states from the first round, and primary health care partners. We are going to start with the first country, our colleague from Djibouti, Dr. Abdi Ismail. Dr. Abdi Ismail, he is the director of the health regions in the Ministry of Health in Djibouti. Dr. Abdi, please come. Yes. Thanks a lot, Dr. Abdi. Second country is Egypt, Dr. Wael Abdelrazik. Dr. Wael Abdelrazik, he is the head of the primary health care and the nursing sector at the Ministry of Health in Cairo. Okay. Yes. Islamic Republic of Iran, Dr. Hussein Farshadi, Deputy Minister of Health, Ministry of Health, Medical Education, Tehran. Thank you. Jordan, Dr. Riham Youssef, Jaipur. Director Education and Medical Training Director, Ministry of Health, Amman. Lebanon. Lebanon, yes, thank you, Mona. Dr. Mona Osman, advisor to His Excellency, the Minister of Health, Public Health in Beirut. Thank you. ما تطلعي دكتور. Yes, please sign. Great. Libya, Dr. Mohammed Ibrahim Saleh, National Health Expert and the Director of the Health Information Center, Ministry of Health in Tripoli. Morocco, Dr. Abdel Hakim Hayan, Directorate of the Population Ministry of Health in Rabat. Pakistan, Dr. Sayed Ghulam, Director, Border of the Health Services, Ministry of the National Health Service Regulations and Coordination in Karachi. Palestine, Dr. Kamal El-Shakhra, Assistant Deputy Minister for the Primary Health Care and the Family Medicine, Ministry of Health in West Bank. Somalia, His Excellency Dr. Yusuf Mohammed Adan, State of the Minister of Labor and the Social Affairs, Ministry of Health in Mogadishu. Sudan, Dr. Osman Ahmed, Director General of Gezira State, Federal Ministry of Health in Khartoum. Syria, Dr. Razan Trabashi, Director General, Primary Health Care Directorate in Ministry of Health, Damascus. Tunisia, Dr. Senia Amour, Director of the Technical Cooperation Ministry of Health in Tunisia. Last but not least, of course, from Yemen, Dr. Ali Ahmed, Deputy Minister of the Primary Health Care Ministry of Public Health Population in Aden. We'll start with the primary, with the primary health care partners, WHO, Dr. Rana Haji, Director of Program Management. Dr. Rana. On behalf, of course, Dr. Ahmed Al-Mandari is the Regional Director for the Eastern Mediterranean Regional Office. UNICEF, our colleague, Dr. Serhari Diota. Dr. Serhari is in behalf, of course, of the RD UNICEF, and he is a health specialist, immunization, and the primary health care in UNICEF. Dr. Serhari, yes, thank you. UNFPA, Dr. Hala Youssef. Dr. Hala Youssef, yes, okay. Sexual and Reproductive Health Advisor, UNFPA in Cairo. UNHCR, Dr. John Selek. Dr. John, he joined us. Yes, اتفضل انت هنا طب هاي. All right, Assistant Representative in UNHCR in Cairo. UNAIDS, Dr. Shireen El-Fei, RD UNAIDS. Dr. Shireen, WONCA, our dear colleague, Dr. Tagreed Farahat, WONCA EMR President. Our dear colleague from Arab Board of Health Specialization, Dr. Omar Rawaz, Secretary General for the Arab Board of Health Specialization in Amman. And the whole Code of Action for Cairo Code of Action for the Regional Professional Diploma, as I mentioned earlier, it is under the umbrella of the Regional Health Alliance, Dr. Jamal Nasher, Coordinator, Sustainable Development Goal and Gender Equity, Human Resources Right at WHO Eastern. Jamal, انت منور يا جمال. All right. Great. Yes. Let us have
البنات قدام راح البنات قدام والاولاد
شيلها بسرعة، شيل البوديوم بسرعة.